Hi, Amanda. Thank you for joining us on Talking Allergies, and we're excited to learn about the Anapen and talk more about it. To start off with, what is the name of your organisation and what's your role?
Hi, Malrick. I work for Aritex Pharmaceuticals, and my role is a National Training Manager for Anapen. And Anapen is an adrenaline auto-injector, and it's used for the emergency treatment of anaphylaxis. I offer training support to many different organisations. As you'd know, Malrick, when it comes to anaphylaxis, there's multiple touch points throughout our communities when it comes to anaphylaxis. So I guess if I was to give you an example, I support registered training organisations. So think of your first aid trainers, so people who might go into schools or businesses and provide education on anaphylaxis. So like your St. John or your Surf Lifesavers. There's lots of these training organisations. I also support people like school nurses and school nurse associations and many other groups because it's really vital that everyone knows how to use an Anapen.
Certainly. And what does your organisation provide for people with anaphylaxis?
Look, we offer them another option of adrenaline auto-injector, Anapen, okay? We have various resources and a website with relevant information. And Aritex also supports these people by providing information, resources and training for their healthcare professionals. So we have a field team out there talking to doctors and nurses every day about managing anaphylaxis and raising further awareness.
Wonderful. And what doses are available in Anapen?
Good question. So, look, Anapen is available rather in three different dose options. I've got some with you that I'll show. So each dose is a different color label, and it makes them more easily distinguished. So when we look at Anapen Junior 150, it's green. Okay, so the device inside will also have a green label on it. The Anapen 300 is orange. And again, the device inside will have an orange label. And then additionally, we also have Anapen 500. So here's your Anapen 500 and it's purple. Again, the device inside will have a purple label. And it's your healthcare professional who will decide which dose is right for you. Interestingly though, Malric, I'm not sure whether you're aware, but there was an Australian study done and it showed that over 40% of anaphylaxis adult patients needed additional doses of adrenaline when in hospital emergency. So we have Askia, who's a peak body of allergy and immunology specialists here in Australia and New Zealand. And they state that one of the 500 microgram doses of adrenaline, so think of your Anapen 500, can potentially prevent the need for further doses, which is really important if you're only carrying one device or if there's any ambulance delays.
How long has Anapen been available?
So Anapen has been available here in Australia since September 2021, so just over 2 years, but it's been available in Europe for many years.
Can you demonstrate on how to use your device, Amanda?
Absolutely. So I've got the real device here with me and a training device. So first of all, I'll just show you the trainer. So this is the training, oopsie, I'll just hold it down here so everyone can see. Training device. And this is the real device, okay? So I'll pop them next to one another and you'll notice that the trainer Anapen is purposely plain to avoid it being mistaken for the real Anapen during an emergency, okay? The real Anapen here has instructions on it with pictures on, showing how to administer. So what I might do, Malric, at this point in time, I'll run through the parts of the pen and I'll use the live device for that. So when we're looking at the pen, we have a needle end here. It's clearly labelled, okay, and it has a black needle cap, which is used for protection before and after use. Moving along here, we have the solution window. So that's just so we can check the adrenaline throughout the year because adrenaline should be clear and colourless. Moving along here, we have what's called the deployment indicator or an injection indicator, and that turns red once the adrenaline's been administered. And then we have the activation end. So we have a red firing button, which is covered with a grey safety cap. Something you might not be aware of is we also have a hard carry case that will be available soon. The carry case includes a QR code because most of us these days carry a phone on us. So the QR code will offer both verbal and written instructions on steps on how to use, and it will also have prompts and functionality to call the emergency services. So it's available in 6 languages as well. So we have English, Cantonese, Arabic, Mandarin, Punjabi, and Vietnamese. I guess at this point in time, it's probably good to show you how to use an Anapen as well. So for this part, I will obviously use the trainer, and just remembering, I'm just demonstrating here. For anyone during an anaphylaxis emergency, they will be lying flat. So again, here's my training device. I normally just hold my training device in my hand like so, okay? The first thing we do is we remove the black needle cap. When we do that, inside there's a grey needle shield that will also come away. The second step is we remove the grey safety cap from the red firing button, and then we place the needle end against the outer part of the thigh, okay? It can go through a light layer of clothing, and we must avoid pockets and seams. We have a jingle, and it says white end on leg, press thumb on red. So we press the red firing button so it clicks, hold for 3 seconds, 1, 2, 3, and then we remove. When we remove, we can see the injection indicator will have turned red. If it hasn't turned red, we should repeat steps again using another Anapen. When the Anapen's been removed, there will be a needle that sticks out, so we use the wide end of the black needle cap to cover the needle end, like so.
Well, thank you so much for that demonstration. And what have you learned from training people on Anapen?
Look, to be honest, I think the biggest thing I've learned is that understanding and education, since anaphylaxis is so scary, really is key to allay any fear, and it also helps build confidence on an unfamiliar device. It's simply just a different device, Malric, to what people are used to. So training really is key. I also remind people that when we use our trainer, we rebuild it. However, with the live device, those steps are irrelevant, okay? It's a single-use device, so concentrating on the steps to use is the most important element when practicing.
Yeah, definitely good to practice on how to use it and also use those trainers. And talking about trainers, Amanda, where can people get trainers and train on the Anapen?
So patients can ask their doctor for an Anapen trainer so they can practice at home and show their family and friends. Their local pharmacist can also order one in for them. And then when you think of workplaces and schools, they typically purchase their own trainer pens, Malric, and will have their own supply. Something people should also be aware of is that on the Anapen website, we have a tab on there and it says Explore in 3D. And this is an additional interactive training tool that's available where people can practice the steps on how to use and also receive 6 monthly training reminders. So I'd encourage everyone to have a look at that.
It's really handy, and it's always good to explore things in 3D and have a look at it. And does Anapen offer a reminder service?
Absolutely. So if you go to the Anapen website, so I guess I should mention what that is. It's www.anapen.com.au. And on there's a reminders tab. So if you click on that tab, you can sign up and you can receive both device expiry reminders and also training reminders. And it's also a really good tool then for schools to use.
Yeah, really, really handy tool. And Amanda, where can we learn more about Anapen?
Okay, so we have a lot of fabulous information on the Anapen website. So I just mentioned that, but again, it's www.anapen.com.au. And I'd encourage everyone to visit the site. Your healthcare provider can discuss any additional questions you may have, as well as whether Anapen 500 is the right dose for you. You can also ask your pharmacist about the product. So Malric, there's a mandatory statement that I'll conclude with, and I'm just going to read that out now for everyone. So Anapen contains adrenaline epinephrine as its only active ingredient. Anapen is not a substitute for subsequent emergency medical or hospital care. Call 000 immediately after administering Anapen. An additional dose of Anapen may be needed while waiting for emergency medical services. Anapen can be obtained from a pharmacy with a prescription or without a prescription where a pharmacist is satisfied the customer has been assessed by an appropriate health practitioner as needing to carry adrenaline, and the health practitioner has provided the customer with a formal action plan for anaphylaxis.
But thank you so much, Amanda. I appreciate you coming on Talking Allergies.
Thank you.